Hey everybody, Dr. Rob Silverman here. I'm with Dr. Ken from Canada. Hey, that's kind of like a funny way to introduce you, Dr. Ken from Canada.
Oh my
Ken's
gosh.
been a bit of a mentor to me. There is nobody better in the realm of muscle testing, assessments, sports orientation, weightlifting injuries than Dr. Ken. And I was just fortunate enough to be interviewed by him. So in that, we were talking about some of the ideas of referral between doctors and PTs, doctors and personal trainers, strength coaches and everything. And I wanted to share with everybody what he's doing because I think it's very valuable, this set of 100 people interviews. So why don't you take it from there? Why don't you tell everybody what you're up to?
Thanks, Rob. Really appreciate you coming on last week. My main focus here is that right now I'm in just outside of Toronto, Ontario, Canada, and our gyms have been closed for 326 days. So is the restaurants, a lot of stores. So it's a lot of real challenges. And one of the things is that how can the health professionals help the fitness professionals? And my whole focus, so I've been doing symposiums for about past 20 years on weight training injuries, nutrition, some of the top techniques, rehabilitative techniques, bring in all the top bodybuilders and powerlifters, and really try and show the best of the best. And it's been wonderful having you present a number of times at Swiss. And my main focus now, I haven't seen too many changes in the treatment world or the training world or nutrition or supplements. There's nothing cutting edge like, the lasers or some new supplement or anything else. And I think what needs to be done right now is the idea as far as how do you build professional referral relationships. One of the challenges that's going to happen through this whole pandemic, once the gyms do open up here, is that how are the trainers, the gyms, the strength coaches going to rebuild their business? And one of the things that I really want to emphasize is that myself as a chiropractor, I have thousands and thousands of patients, 20,000 patients. This is my 30th year of practicing. So I can refer a lot of people to different trainers and strength coaches. The challenge is that how do we refer that? And I don't know what a lot of trainers do. And my focus is for them to, number one, level up, meaning that become really, really good at something. And what I really appreciated, the other last week, Rob, is that you refer out all the time. Mm-hmm. Like you do acupuncture, but you'll refer out to acupuncturists. And I do the same. Like you have to really know what your lane is. What is your niche? And, you basically inspired me when you said, you need to connect before you communicate. And that's one of the biggest things is that a lot of times trainers will come in and try and create a referral, from me, and they'll just come in with their business card and they'll go, have Dr. Kinakin give it to, the front desk, have Dr. Kinakin refer, all of his patients over to me. I'm a new personal trainer here. I can take care of all of his patients. That's the worst thing you could actually do. Because I don't know you, I don't like you because I don't know you, and I sure as heck don't trust you. And trust is it takes time. It's almost like dating. It takes time to build that trust, build that relationship. And so my main focus is to interview all the top people that have been at Swiss and other ones that have not in different streams. So this thing is blown up. I originally thought I'd get maybe 15, 20 presenters from Swiss. It's now over 100. And so what I've done is spread it out over 9 weekends. So it's going to go from May 29th to September 26th. I'm going to open up every 2 weeks. It'll be free so that they can watch it. And, if you want to buy a package for the entire thing, it'll be about $100 that you can watch all the presentations, all the videos, all the audio and transcripts and everything. But my main focus here is that, to give different trainers, different strength coaches, and also doctors and therapists and nutritionists and lifestyle consultants, a resource of, the best from the best. So it'd be, my whole thing is that, wouldn't it be cool to get, a referral from Dr. Silverman? And everyone's like, yeah, that would be awesome. Well, you know what? Here's his expectations, which is a lot different than some of the other people that I've interviewed, because, you came in with we need integrity. We need to connect. And you went basically more humanistic as opposed to what's your certification, what are you good at, and anything else. So I that's one of the main things that I'm trying to really, infer. And the presentations will be short, 15 minutes, 20 minutes, kind of like a TED talk, and they'll all be pre-recorded, so there won't be any glitches.
Well, I mean, I think what you're doing is great. Trying to make that connection, trying to help people out at a time of need. And, one overriding thing that people don't realize is that, there's the quarantine 15, there's a quarantine 25. So we see the Patrick Schwarzeneggers of the world who had the access and really did a great job, gaining weight, muscle, and everything. So we're seeing that lane, but we're also seeing maybe 75% of Americans, or North Americans, if you will, have that quarantine 15 to 25. And in a health pandemic, the most important thing is to get healthy. So by you doing this communication, by you interlinking, you teaching everybody how to help each other so people can get healthy. One of the things I didn't say last time that I should have shared with you is, there's 3 things that I was told when I went into practice. I went to this guy and he had this banging practice. And I was expecting without question for him to tell me something so slick and business savvy. And he said, you know what? Here's 3 rules. Treat every patient like you would want your mom to be treated.
Awesome.
Find your niche and market it. Let everybody know what you do. Now, somebody made a real big comment on connect before you communicate. Without question, I had a patient come in yesterday and just in my office. And she said, I'm a very sensitive patient. There's a lot of things going on. And she needed me to put my hand on her and say, it's okay. I'm listening. I hear you. I feel that you're sensitive. I'm not going to adjust your neck today. I got it.
Yes. Yeah.
So the idea of, connection before communication is critical. I mean, if you look at our politicians, those who connect, and I know it's a horrible conversation, they do better because then they're good communicators. And the same for doctors, same for a trainer, especially for those trainers, especially for those strength coaches. I want to ask you some questions about that, who stay with the patient for an hour and a half. So could you tell everybody what the difference, we'll start with this, between a physical therapist, a personal trainer, and a strength coach is? And if you really want to go for it, and an athletic trainer.
So, yeah, I think the biggest thing is that you have all the different professions and you can create whatever that you want. So a strength coach to me is someone that focuses in on a specific sport. And so I know a lot of strength coaches can do a lot of different things. My whole focus is that how can you become the best of the best? And so in order to do that, you need to focus in on just one area. And it doesn't matter if it's football, if it's soccer, if it's baseball, basketball, because they're all different sports. Can you use some of that information in different sports? Absolutely. But the challenge being is that you just don't have enough time to learn all of that, and also the expertise. So from a strength coach standpoint, I usually find they're really the best ones that I know focus in on just one area. As far as a physical therapist, there's 3 here in Canada. They're called physiotherapists. Same thing. What I find with the physiotherapists, and I've hired many of them, is that there's 3 different types of physiotherapists. One is that they are really rehabilitative exercise focused, which is fantastic. Other ones are really good with modalities, ultrasound, IFC, shockwave, and they're also brilliant. And then the last one is some of them are very good at manipulation, very similar to what we do in chiropractic. And some of them are really, really good. There's a lot of great physiotherapy techniques as far as, how to manipulate the joints and how to create and restore motion back into those joints. So that's sort of what I've seen over my years as far as practice. As far as the athletic therapist, they're also really good, and they actually they're hands-on on the field. If there's any type of issue, they're almost like a paramedic for an injury that happens on the field. They can assess it, triage it. How bad is it? Can you play? Can you not play? And then also they can do the rehabilitation from the post injury, and they can work with the strength coaches. And that's some of the best teams that I've seen, is that you have the athletic therapist work with the strength coaches and work together. And there's almost a melding. My whole focus is that you need to build a team. You need to know what you're really good at. And then from there, then you can really make a big, big difference.
Agreed. I think the team concept, patient first. People come in and go, what's your mantra? So I can give you my mission statement. We've talked about it, creating health for future generations starting now. It's exciting. My mantra is, as long as the practitioner, or the person you go to, is putting the patient first.
Yes.
That's that idea of integrity.
Absolutely.
I mean, right, where they're like, well, I don't really want to work with them because they want to give me $20 instead of $200. I get it, and you get it. We all have to pay rent. We got to pay for the mic. We talked about the new settings and social media, both trying to do a better job. But if it's all about money, then it's just simply all about money. And it's very funny. So some people, and we could talk a little bit about this because I had some people ask questions. I want to be a trainer, but I'm not sure what I'm going to make. Now, what's interesting is that I have people from all walks of life, and people who enjoy what they do got that big smile on their face.
Yeah.
I mean, we deal with some people that have a lot of money, and, so you got to be happy. You got to be healthy. And again, there's some value, there's some intrinsic value. I mean, somebody comes to work with my wife, and it's in the driveway, and he's got this big burgeoning smile on his face because she's pumped, and he's pumped, and the whole thing. And, people see it, and he's doing well from it. We're referring, but the bottom line is that team concept, and that team where the patient comes first. Yes. Now, the thing that you and I probably want to talk about, we talked a little bit about integrity, but how about the ability to excite or allow that person to have an epiphany? Did you ever send somebody and you go to the barber and he looks down and he's like, oh boy, I got to cut another hair. It's like, dude, you're not touching my hair. I'm a little vain. That's not working. Could you imagine the trainer? Could you imagine the strength coach? I got to teach another clean and jerk. Oh my God. So that's stuff that we're looking for. So my question for you is, as chiropractors, do you feel the chiro is the anchor for that flow chart in the referral system?
I think so. It's what I do personally. And I find that a lot of people, so I've been practicing quite a long time, similar as yourself, doctor. And what I find is when people come in, they have preconceptions as far as what we do chiropractically, that, you're going to see me for the rest of my life. We're going to take all your money. There's a lot of practice management, and I've been part of some of them, and I'm not part of any of them. I basically created my own style on that. But what makes patients and actually even myself feel a lot better at the very, very beginning, I explain what I'm going to do and how I pre-frame my actual exam. And so I explain step by step what I'm looking for. It's a muscle problem, joint problem, nerve problem, nutritional problem, and then, maybe a combination of that. And then here's the key point. And once I say this one phrase, the patients all of a sudden start breathing, because now it's on a completely different level. And I say, you know what? If I'm able to help you, I'll let you know. If I'm not able to help you, I'll let you know that too. And I'll refer you on someone that can. And as soon as I say that, they smile and they go, thank you. Because it's kind of like it's changed the entire conversation after that it's not, is he going to give me some plan? Because I've heard, they may have gone to a chiropractor and they got on the block system where it's 3 times a week for 6 months. And sometimes that's needed. But a lot of times it's more of a marketing campaign. It's a patient volume. What's your PVA? Meaning that, for the chiropractor, it's like, I've seen this person 100 times. I see him maybe 10 times, and people are like, well, Ken, you're not very good because you've only seen him 10 times. And I'm like, yeah, you know what? If that's all they needed, then that makes a huge, huge difference. And the conversation gets away from, the money aspect and everything else. So I found that very, very powerful. As soon as they do that, then all of a sudden they know that I'm creating a team and a refer. And a number of people that come in. So I have a large practice, about 50%, that the trainer will come in with their client a lot of times. So they'll sit there as I'm doing my new patient exam, and I ask the trainer, please come in, and we build a health team, and we can have the discussion in front of the patient, and the patient feels so special, and it doesn't take any more, than that.
Yeah, that PVA, so patient visit average. And we talked about that in school. You can have 1,000, one person 1,000 times, 1,000 persons one time, and we should be rated by outcomes.
Yes,
and,
I do.
And that's where at least chiropractic in the health insurance, nasty word, has really shown to be excellent in that our outcomes have been great. And, we could talk a little bit about what we do, and it's musculoskeletal light. That's the basis of what chiropractic is. Central nervous system into musculoskeletal. You use a lot of muscle testing, a lot of AK. I do some functional movements. You love weightlifting injuries. That's your thing. I love these tough cases that people come in and it's some sort of weird nerve entrapment and everything. But the bottom line is we all have that same mantra. And chiropractic, all these things offer great alternatives to the traditional medical model. And not that the medical model doesn't work. It has its place. We use medical doctors. We refer to them and we get referrals from them. But the bottom line is right now we're in a health pandemic and you're in a lockdown. We're in a health pandemic because people are getting sick. So wouldn't it make sense to do things to help your immune system, whether you've got a vaccine or not, whether you've had COVID or not, or whether you've had none of the above, you still need a strong immune system. And, nobody talked about it till 14 months ago. And now that's all we're going to talk about for the next 10 years.
Yeah. And actually, even in the mainstream, they're still not talking about it, whether it be vitamin D, whether it be zinc, quercetin, all these different, all these different supplementation that can help the immune system. We've put so much emphasis on the vaccine, which is very important, and all the other, hygiene aspects, just, make sure that your hands are clean, cough into your, sleeve, clean your table once in a while, all these different things. I have a UVC light, UVC at 254 nanometers. So it's able to basically sterilize the air. And I do that in the beginning of the morning and also at lunchtime in each of the treatment rooms. So therefore, because, with this virus or any type of virus, would be influenza or anything else, that, it will basically destroy any of the viruses that are aerosol.
How about this? I'll give you one factoid for today. And not that we're trying to do a diatribe. 300 calories of carbohydrates. So that's like a Frappuccino on steroids, if you will, or a Frappuccino is 300 calories on steroids, decreases your immune system function for 2 hours by 50%. So here I am traveling, and they're all wearing a mask. And well, we all should. I wear a mask. I just don't have to wear one right now. I'm in New York. But they're drinking a Frappuccino and then going into an airport and they're on a crowded plane. And it's like nobody's telling them maybe that's not the good choice. Maybe don't eat the gluten in a pretzel. Maybe choose something different. We're getting some great feedback. Dr. Diane said exercise. Jose's been really talking about life transformations. Matt here said case study videos and testimonials can highlight everything you do. I agree with that. I want to speak to that. And, we're both picking up our social media game. We've got all the things going on and everything like that. And he's right, without question. How do you know somebody's good? Well, obviously they can have a system that captivates everybody's referrals. So you can look at these, like a restaurant, you see all these, it's really, really good. And they have a team that does that. But those video testimonials and that video of the practitioner or the doctor with the patient, you can't lie about that because people don't always like that to be on a video. You can't lie about that. You can play games with the testimonials, and our testimonials are good, as yours are also. But that video where somebody sits there and looks at you with integrity and authenticity is critical. So let me ask you, the Swiss, because I know we're running into, you have something to do. The Swiss, what is it? When is it coming back? And I'm ready to go.
All right. Well, so Swiss 2021, which is the virtual summit, is going to start on May 29th, May 30th. And you can go to swis2021.com. I just built the website, just finished it last night. So you can go there and get sort of the idea of what I'm actually doing. And again, it'll be free if you want to watch it in real time. The actual live symposium, our borders are still closed. So Ontario has closed the border from Ontario to United States, but they've also closed it from Ontario to Quebec and Ontario to Manitoba. So you cannot literally leave the province. If you go there and you don't have a good enough reason to go to Quebec, they have police checkpoints all the way across. So this has gotten a little bit interesting, a little bizarre, to be honest. So hopefully things will open up. And if they do for the fall, then I'll be running something. I could throw it together pretty quick. I know the hotel very well, and I have the full team, and we can bring it in and bring you in again, as far as setting that up. And if it's still really weird in the fall, then we'll do it in 2022. Everything is just fluid, because I was originally supposed to have it in October of 2020, and obviously I had to change, everything.
So I'm going to hit you with a suggestion.
Yes.
I was just thinking about it. I think what you'd love is, all right, you're doing the virtual, which is great. If you're unable to do it till 2022, which is conceivable, but disappointing, I would have a couple of round tables and just do it like that on one day. That's just my suggestion.
That's a really, and I just might do that, because just to try and logistically throw everything together very quickly. I have done it where I've thrown together the entire symposium in 8 weeks and had, I don't know, 600-700 delegates with about 30 presenters. So I can do that. Roundtables are fantastic, especially now. And again, I think it would be an extension from the what I'm trying to do here from the virtual summit, as far as how do you build that connection. So it'd be almost like a giant meetup where you can meet with different people and find out and connect and everything else. So I think that's a phenomenal idea. I agree with you, Jose.
Jose, muchas gracias.
Yeah. No, we need to connect again. We've been so focused on, staying away from each other. We actually have a stay-at-home order here. We're supposed to stay home. We're not even supposed to go to work.
Wow.
So I think that's the connection. And for me to be able to reach out and teach people on how to connect with health professionals, such as yourself, such as myself, strength coaches, because I'm asking everyone the same 3 questions. What does it take in order for you to refer to a personal trainer or strength coach? What does it take in order for you to refer to a chiropractor, massage therapist, a physiotherapist, nutritionist? And what can they do on Monday morning? And all the people that I've been interviewing, everyone's giving me a different answer, and I'm like, wow. So this is really powerful for me just to understand that. And then my whole focus is just get one thing from each presentation, and for you really taught me in the sense of start out with integrity, connect before you communicate, really try and understand who you're talking, do some research, Google them. Do they have a website?
Yeah. You know what? That's a great point. People, I know this great doctor, and he doesn't even, or she or whatever, doesn't even have a website. That's, it's possible, but that's, even my dad, who's 90, has a website. I mean, he even understands social media. I mean, there's some things he says and does, like he'll ask my nephew, who's 31 years old, and things that he's not supposed to ask him on social. But, nevertheless, you should, without question, check out the docs, see how the referrals are looking. Now, in reference to the Swiss and what you're doing with this virtual from May 29th to September, how can they get in touch with you?
They can go to swis2021.com, and all the information is there, and you can register for them. And I'm mapping out all the different weekends and what type. So each weekend is similar to Swiss, where I have different streams. Well, I'm going to have different weekends. So one weekend's going to be all the strength coaches. One weekend is all the doctors and therapists. Another one is all the nutritionists. And what I want everyone, if there's one piece of advice that I could give people, is that you need to level up. You need to become really good at something so that you stand out. So sort of like, you have priority of mind. My girlfriend, Wendy, she's a firefighter. She's been a firefighter for 13 years. And her focus now is how can she help the firefighters nutritionally? because they're exposed to so many different things. And it's great, and, you know, that you're going to be able to also help her, you know, with some of the information, because I know that you've worked with firefighting associations. So that's a brilliant idea in the sense of taking something you already do, and how can I help? How can I make a difference as far as the foods, the supplementation? What are you exposed to? But with the trainers, they need to focus in on something. And the whole thing is that, you know, is it a body part? Do you want to become the top person, you know, for a certain shoulder? You know, Brett Contreras, he does it on the glutes. Like, I mean, he created the whole thing. You know, you have Jose, no, it's SWIS. Here, let me write it down. Some people are writing it down wrong.
All right. So while you do that and you put that out, somebody as chiropractor said cortisol causes inflammation, not to do, to be discursive. Is that true? Cortisol or elevation of cortisol, and I will answer the question later. I'll put it in the thread, can definitely cause inflammation. Cortisol is highest in the morning. I know, Ken, did you put it in the thread for Swiss, or did you want me to?
Yeah. Could you do that? Yeah. So this is,
yeah, put it that way. Swiss, you got that, Steph?
SWIS
20. Yep, I'm going to actually do that right now.
SWIS 2021.com.
There you go.
Yeah, you know, it's so the whole thing is that we all need to become really good at, yes, there it is. We all need to become really, really good at something. And I'm well known as, you know, the weight training guy. So if you have an injury, come and see me. So people from all over come and see me. And that's the biggest thing that we can really try and do, is level up. The age of the general trainer has diminished. People have figured out how to train on themselves, you know, doing YouTube, you know, just figuring it out on their own. And so if you specialize in something or a certain group, that will make the biggest difference.
So somebody says the link's not working, so you'll address that.
Yeah, I'll make sure that it's working, Matthew. Thank you.
You got it. Well, Ken, as always, it's my pleasure.
It's always wonderful
to get in touch with you if they have a question, they're up in your woods when you guys reopen and they need a great chiropractor. How can they get in touch with you?
You can just go to my website, drkenkinakin.com. Yeah. So or follow me on Instagram or Facebook.
Absolutely. Yeah. Well, Fantastic. It's been my pleasure again. We kept
Always
it in the time frame that we talked about.
Yeah.
And everybody, you know, check in. We're going to be on a little later, believe it or not. We're going to be talking about some interesting topics. We'll be doing a lot more podcasts. And follow Dr. Ken. My name's Dr. Rob Silverman. Always
Thank
yours
you.
for health. My
Wonderful.
pleasure.
Thank you.
Thanks for coming.